Hi, my name is Dr. Pavi Kondal. I'm a general surgeon in the Toronto area. I've been practicing for the last 16 years. I do work out quite regularly with medical students, and I often get asked, how did I choose surgery versus other specialties? When I started medical school, I was 20 years old, and my only concept of what a physician was just seeing my family doctor. And as I started clinical rotations, I obviously got exposed to the different specialties. I had never really thought about doing surgery. And when I did my first clerkship rotation, I actually had a surgeon who ended up becoming a mentor for me. And I was really inspired and found the work quite interesting. I really liked the fact that there was a problem as a surgeon that you could see, you could diagnose, and you could fix, and the patients would get back on with their lives. So I did enjoy that. I also found that I did like working with my hands. It was nice to develop my dexterity and see over time, your clinical and technical skills improve. Now, it is very hard when you're a medical student trying to decide what type of specialty you want to do for the next 30 or 40 years. You're often in your early to mid 20s. You may not be married, you may not have kids. Um, I chose to do general surgery because I liked the emergency component to it, and I liked the acuity and taking care of sick patients. But obviously, as I've gotten older and I have kids now and more demands in my personal life, that does become more challenging. You have to balance your work commitments with your family life. And to be honest, as you get older, it does take longer to recover from a grueling call shift. And the work is quite physical. That's one thing I didn't appreciate as I got older was the physicality involved in surgery. You are standing on your feet for 8, 10, 12 hours. Sometimes the ergonomics are not good, and you do start to feel it as you get older. So you really have to spend time stretching and taking care of yourself. I have found being a surgeon very rewarding. I've helped hundreds of people in my career, and I can truly say I have saved people's lives. And I think when you look back, that is very meaningful, and you will feel that you did make a positive contribution to your community. If I was going to give any advice to anyone choosing to be a surgeon, I think firstly the positives are you definitely get to see the results of your work. You will cure patients of cancer. You will fix problems such as cataracts or hernias. So that again is very rewarding. You are relatively well compensated. You work hard for your income, but you are well paid relative to most people in society. You get to work with very interesting people, which I think in general medicine is one of the real bonuses, that you get to work with very talented and diverse people, which makes the day to day work very enjoyable. In terms of some negatives, as a surgeon, you often are tied to a hospital. Obviously, plastic surgeons can create private clinics, but in Ontario and Canada, in our public healthcare system,